So what we're expecting and aiming to do with AposTherapy is to hopefully avoid surgery outright, and for others to give them as much longevity so that they can keep managing their day-to-day tasks with as little pain as possible.
One of the therapists, Chris, rang me at home and explained what AposTherapy was about.
The inner part of the joint which starts to become quite degenerated, and that's generally the most common form of osteoarthritis. What we see is that it's not just a bony problem, it's very much the actual muscular system that's actually working to compress that side. So what we need to do is find an option to reduce their tightness in the joint, which over time will reduce the risk of surgery.
I came to St Michael's and for an interview. It was quite interesting what he was saying, but I was very sceptical.
For those patients that don't want to have surgery and they want to have an alternative option, AposTherapy we found is the best alternative for them, mainly because it's doing the two things. What we're aiming to do is make adjustments to move the pertupod to actually offload and offset that painful joint. We can make adjustments to change the alignment to actually reduce the forces, i.e. less pain when the patient wears the device. And secondly, so as the patient kind of stands, there's a slight wobble in that device, and that instantly actually starts to engage those muscles. Essentially, why we want that is to work the muscles which are tight and overworked around the joint to start to work more efficiently. We would start with something around the idea of half an hour wearing the device, including sitting time, and of that time, around 20% would be actually moving around pottering. So it's very much little and often activity, so there's rest breaks.
There's a questionnaire on an iPad. It's very simple. You just put on there whether you have trouble putting your socks on, when you get up in the morning, do you move about easily. There's all sorts of questions, climbing stairs and coming down the stairs. But that builds a profile, and it's really useful when the graphs all come in on the second or third visit and you start looking, actually I'm making progress, better than I thought I was going to be doing. The reports that come in every time help. The therapists give advice on any problems you've got with the boots or even other things. And the people that you're dealing with, from the hospital staff themselves to the AposTherapy people, they have your welfare at heart, and it really does come across. I've had a couple of therapists since Chris, and they've all been excellent. They answer every question honestly. They tell you not to expect results instantly, but it is a long process, and you're trying to correct things that you've been doing for years.
The patient would come to see us on their day one, and that's a referral via the GP. These patients are ones that meet the criteria potentially to have a total knee replacement. Now what we do on that day is we assess for their suitability for the device, and we would, as we did with Vic, watch them walking, and once they're deemed suitable, we'll actually set them up in a device. We'd expect them to come back up to 5 to 6 times thereafter so that we can monitor them across the year to be able to get the best optimum results for them.
My goal is to hold off this operation for as long as possible. If I can make it to when I'm 80, I'll be fine. Yeah, that'll be good.
From our testing and questioning patients, there's a 95% satisfaction rate, and of that, 86% of patients actually go on to do the activities that they once used to do with a lot less pain without having the surgery.
It does work, and it's nice to know it's not my imagination, and it's a really good experience.